You all, welcome back to my YouTube medical classes channel, medical classes by Dr. Srinidhi Kumar Acharya. Please subscribe my channel and also please give your valuable comments. So in the last class we are discussing about acyanotic heart disorders and how a acyanotic heart disorder occur and what are the different causes. Okay, just like VSD may be there, PDA may be there, ESD may be there. Okay, some other rare congenital abnormalities may be there. So how to differentiate these things and what are the types, all such aspects has been covered in the last class. So today we will basically discuss on acyanotic heart disorders. Acyanotic heart disorder. Now before coming to today we will discuss about cyanotic heart disorder. Cyanotic heart disorders. Acyanotic is over. Now today we will discuss about cyanotic heart disorders. Now before coming to the cyanotic heart disorders, we should understand what is actually cyanosis and how it develops, what are the types and how it is related to the cardiac problems. So then our understanding will be quite easier. Now cyanosis, whenever there is a cyanosis, it always suggests that there is increased deoxyhemoglobin level in the blood. Everybody knows this. Okay. So there is decreased oxygenation and also there is decreased peripheral perfusion. These are the two things which actually come to our mind whenever a patient comes to cyanosis, because a patient of cyanosis may come with the peripheral cyanosis and he may come with the central cyanosis. If the patient is coming with the peripheral cyanosis predominantly, then the cause is decreased peripheral perfusion. That means the peripheral parts of the body is receiving less amount of the blood. When peripheral part of the body is receiving less amount of the blood, the oxygen concentration is also less, and as a result, there will be development of cyanosis. This is actually what is happening in case of peripheral cyanosis, which occurs during the winter season. In the winter season, we feel cold and cyanosis. That is because of the decreased peripheral circulation, because of the spasm of the arteries, because of the cold effect. There is spasm of the muscles of the artery, and as a result the distalmost part of the body is not able to receive the blood, like fingers and all, digits and all, and therefore there will be development of cyanosis, and this is called as peripheral cyanosis. Okay, we know that similar to the peripheral cyanosis in the newborn baby, we will have acrocyanosis immediately after birth. The cause is same. एक्रोसाइनोसिस रहता है जो बॉडी का पेरिफेरल पार्ट्स में रहता है. जैसा आपने थोड़ा बहुत ऑक्सीजन दे दिया तो एक्रोसाइनोसिस धीरे धीरे खत्म हो जाता है, बिकॉज immediately after the birth what is happening is baby is trying to breathing and it is establishing the breathing. In the meantime, total amount of the oxygen which is going inside is less, therefore all the body parts are not equally get perfused by the oxygen. But once you start giving the oxygen and all, what happens? Baby is receiving more amount of oxygen and that will be perfused and cyanosis will going to disappear. So one of the best way to understand the peripheral cyanosis is getting better by two important things. Suppose a patient is having peripheral cyanosis. If you increase the oxygen concentration, then the peripheral cyanosis disappears. That means just give oxygen, the peripheral cyanosis disappear. Or if you increase the body temperature, body warmth, in case of cold conditions developing into cyanosis, just make your hands warm, the cyanosis will go into disappear. So this is how we have to differentiate peripheral cyanosis. Peripheral cyanosis is nothing to do with the mixing of the blood. Okay, it is only decreased oxygen concentration in the blood, and also it is only with the decreased perfusion or because of the spasm of the muscles. Hello sir. हाँ सर. नहीं सर, नहीं. श्योर. हाँ सर, हाँ. नहीं कुछ नहीं है, मुझे नहीं चाहिए. नहीं कुछ नहीं. हाँ. नहीं अंदर ही मैं बाद में बात करता हूँ. So cyanosis, the peripheral is due to perfusion or spasm of the arterial muscles and improve with the oxygenation. That is one of the very important criteria. Okay, Peripheral cyanosis disappears by giving oxygenation. Just remember it. Peripheral cyanosis disappears by giving the warmthness, okay, by increasing the temperature. That's all. Now come to the another part. So what do you mean by central cyanosis? The central cyanosis, here also there will be cyanosis, okay, but the cause is not these two. There is no decrease or oxygen concentration, or there is no increase or cold effect. The cause is something different here. Central cyanosis means there will be mixing of the pure and impure blood. Okay, so when pure blood is mixed with the impure blood, then what happens? Naturally oxygen concentration falls down. Suppose 100% pure blood is mixed with the 100% impure blood, then the oxygen concentration comes down to 50%. And that is 50%, that is the cause of cyanosis. Okay, so in case of central cyanosis, there will be mixing of the pure and impure blood, and the oxygen partial pressure will fall. Okay, so there, heart disorders. Now this is actually happening in case of cardiac problems. Okay, in the cardiac problem, actually a congenital cardiac problem is there, and there is development of the cyanosis. Very rarely there is development of the peripheral cyanosis, or no development of peripheral cyanosis. That may occur. Central cyanosis and peripheral cyanosis both can exist together in very chronic cardiac problems. Otherwise, all the cardiac problems, congenital cardiac problems in the children, so they do develop the central cyanosis, where there will be mixing of pure and impure blood because of different congenital problems. Okay, now as we know, in case of heart disorders, basically it is divided into cyanotic and acyanotic heart disorders. Acyanotic heart disorders we have already covered. Okay, so but sometime even in cyanotic heart disorders we can see the cyanosis. This we know. Okay, cyanotic heart disorders. So in that, how to identify that whether this child has got really a central cyanosis due to some of the congenital cardiac problems? One of the easiest method is we can forcefully try to understand that how, if while the baby is crying, you have to see whether while the baby is crying, whether baby is getting cyanosed. You have to see whether the baby is sucking the breast milk, baby is getting cyanosed. Or you have to see when baby is hyper excited or baby is overexcited and overexerted. So that time whether child is getting cyanosed. So if this is seen, then itself it is one of the clue for cyanotic heart disease. Okay. Let us go further. Many times mother says, ठीक है, बहुत बार मदर बोलती है कि many times mother says child was looking bluish for some time when he is crying. So this is OPD level में मैं बात कर रहा हूँ. So many times parents come with this particular complaint when baby is drinking the milk or feeding, or when the baby is crying, okay, or baby is overexcited. Sometimes baby is getting bluish. Now this is a big clue. Now there is a need to differentiate between the breath holding spell and cyanotic heart disease. This is very important. Okay. So what I mean to say, many time mother says that मेरा बच्चा जो है थोड़ा नीला पड़ जाता है जब ये क्राई करता है, ओवर एक्साइट हो जाता है या फीडिंग करते. So now this particular cyanosis which is occurring in children can occur in two conditions, especially infantile conditions. Two conditions. One is breath holding spell and another one is cyanotic heart disease. That is our matter of discussion today. Breath holding spell also produces cyanosis. Breath holding spell also produces a cyanosis. So therefore, it is very important to understand the sequence of events that occur in both the situation. So हमें ये पता होना चाहिए कि breath holding में क्या होता है और cyanosis, congenital cyanotic heart disorder में क्या होता है. ये दोनों समझना बहुत important है. Let us try to understand the first one, the breath holding spell. What actually happens in breath holding spell? See, crying will be initiated by certain triggers. बच्चा जो है तुरंत जो है cry करना शुरू कर देता है because of certain triggers, like not picking up the baby immediately, or any other painful conditions, or stubborn child, etc. Okay, so then the child will take the deep inspiration. Child start crying, and child now will take the deep inspiration. on the peak of the inspiration, now what happens is, एक बार peak of the inspiration होने के बाद क्या है कि expiration शुरू होना है. But in breath holding spell, what happens at the peak of the inspiration, the expiration will not stop. Rather, either the expiration will stop there only, or breathing itself will stop there only. Okay, so either it stop the cry or stop the respiration. At the peak of the बच्चा सांस पकड़ लेता है at the peak of the inspiration. Okay, so we will this condition is medically called as an apnea. Okay, this is called as apnea. If the apnea is more than 20 seconds, it is always abnormal. Okay, so there will be apnea, so child will be unresponsive. No, बच्चे ने breathe hold करके रखा है और apnea का stage में है, and child is not giving any response now, it is unresponsive. Okay, this may lead to the development of the cyanosis, because see, baby hold the breath and there is no oxygenation taking place. Inspiration has been stopped, it's in the period of apnea. So inside the body, what happens? The oxygen concentration falls. When the oxygen concentration falls, there is the development of cyanosis and child become bluish. Okay, now this child will be floppy on lifting, just like the rope. अगर उसको उठाएंगे तो एकदम पूरा नील हो जाता है, वो रोप जैसा हो जाता है या फ्लॉपी हो जाता है. And mother and father, parents are very much worried by this condition. Child is totally nil. Okay, it is not giving any response. Meantime, there is cyanosis, and if you check, there is also bradycardia in the later stages. Okay, so this also leads to hypothermia. Okay, because circulation is not going on, no oxygenation, no circulation, hypothermia will be also there, and there is also bradycardia. So this is what actually happens in case of breath holding spell. But this has to be differentiated. Of course, breath holding spell में दो टाइप है, ठीक है. एक पैलिडा, ब्रेथ होल्डिंग टाइप में पैलिडा है, मतलब जो एनीमिक पेशेंट में होता है, ठीक है, जो बच्चा है जो ज़्यादा एनीमिक है वहाँ पे होता है. एंड अनदर वन इज common one, breath holding spell. Okay, so that we will not discuss now. Now what happens in case of cyanotic heart disease? In case of cyanotic heart disease, this is what happens in case of breath holding spell, we have already seen. In case of cyanotic heart disease, any activity which increases the intrathoracic pressure or work like cry or exercise or playing etc. So क्या होना है? See, if you see in case of breath holding spell, intrathoracic pressure के साथ उसको कोई लेना देना नहीं है, ठीक है. At the peak of the inspiration this starts. Okay, so now, but in case of congenital cyanotic heart disease, the cyanosis always develops whenever there is any condition or any manner where intrathoracic pressure has been increased. For example, cry. When you are crying, intrathoracic pressure increases. Doing exercise, intrathoracic pressure increases. During playing, intrathoracic pressure increases. During sucking the breast milk, intrathoracic pressure increases. Okay, there will be cyanosis during this time. So after the same and again here also, if the same bluishness or the cyanosis stand for a long time, then child will be again unresponsive. So child with a cyanosis in cardiac disorder, child is, in case of breath holding spell, what happens? There is cyanosis, and immediately after cyanosis, what happens? Child is totally uncomfortable, it is rope-like and unresponsive. This type of situation is not seen in case of cyanotic heart disorder. Child with cyanotic cardiac disorders, Rago, ಬಾಗಿಲು ಹಾಕಿದ್ದು ನಾನು ಆಗದಿಂದ ಕರಿತಾ ಇದ್ದೇನೆ, ಬಾಗಿಲು ಹಾಕಿ ನಾನು ಆಗದಿಂದ ಕರಿತಾ ಇದ್ದೇನೆ, 10 ಸಲ ಕರೆದೇನೆ ಬರಲಿಲ್ಲ. Child with cyanosis in cardiac disorders, child is comfortable and there will be clubbing and there will not be always central cyanosis. Okay, so and clubbing takes a month to develop. That means cyanotic heart disease mein cyanosis will develop only on any condition where there is intrathoracic pressure increases. Okay, and again, although intrathoracic pressure increases, cyanosis develop, there is bradycardia, hypothermia, ये सब कुछ नहीं होगा यहाँ पे. Child is comfortable. Only doing this exercise etc. or crying etc. it develops. Then the child is normal. Okay, so when you stop that intrathoracic pressure increasing, the condition will be normal. And all the other symptoms like the clubbing etc. they develop very slowly. So this is one of the best way to differentiate a cyanosis which is occurring in breath holding spell and cyanosis which is occurring in case of a congenital cyanotic heart disease. Now to be safe, जो भी बच्चा जिसको breath holding spell होता है, ठीक है, जो भी बच्चा है जिसको breath holding spell होता है, एक बार हो गया, 2 बार हो गया, मदर आपसे कंप्लेंट कर रही है, देन इट इज ऑलवेज प्रिफरेबल टू चेक द कार्डियक प्रॉब्लम्स ऑल्सो, क्योंकि दिस इज वन ऑफ द वेरी इंपॉर्टेंट डिफरेंशियल डायग्नोसिस. हो सकता है कि उसको कॉन्जेनिटल कार्डियक प्रॉब्लम भी है, इसकी वजह से उसको जो है साइनोसिस हो रहा है. ठीक है, वो ब्रेथ होल्डिंग स्पेल से हो रहा है या कॉन्जेनिटल साइनोटिक हार्ट डिसऑर्डर से हो रहा है, हमें पता नहीं है ना. सो इट इज ऑलवेज बेटर टू गो फॉर वन टोटल कार्डियक स्कैन. ओके, 2D echo or whatever you want. Okay, so this is one of the important thing in cyanotic heart disease. Further, now we have to differentiate another type of the cyanosis which occurs in respiratory disease. Sometime in respiratory disorders also there will be cyanosis. Most of the time in chronic respiratory disorders, so we will have cyanosis which is of a mixed type. There is also peripheral, there is also central. So otherwise the cyanosis in case of respiratory disorders, it can be differentiated. How? Very simple. If you provide the oxygen concentration, most of the time in respiratory disorders cyanosis will go to disappear, and usually it is seen in chronic pulmonary problems. Okay, that means chronic obstructive pulmonary disorders or this bronchiectasis or some of the chronic problems, only this cyanosis develops. Simply it will not develop, and if at all it develops, it will controlled by or disappear by giving oxygenation. Okay, and usually it occurs in chronic respiratory problems. Therefore child always looks sick, and the clubbing may or may not present. Sometimes in the chronic clubbing may be present, sometimes it may not be present. Okay, now come to the basic part, that is cyanotic heart disorders. So how to differentiate this cyanotic heart disorders and how to study that. So we have seen all the differential diagnoses. Now come to one of the type of congenital cardiac problem, acyanotic heart disease and cyanotic heart disease. Acyanotic we have covered. Now come to the cyanotic heart disease. Suppose a child has got cardiac problem, congenital cardiac problem, where there is cyanosis developing. Okay, cyanosis not developing, we have seen VSD, PDA and many things. Cyanosis developing. Okay, now this is again divided into two types. One is cyanosis is developing with increased pulmonary flow. Cyanosis is developed with decreased pulmonary flow. है ना, कि कंडीशन है कार्डियक प्रॉब्लम का, कॉन्जेनिटल कार्डियक प्रॉब्लम का, साइनोसिस भी साथ है. अब साइनोसिस भी साथ है. पॉइंट नंबर 1, साइनोसिस साथ में है बट पल्मोनरी ब्लड फ्लो इंक्रीज रहे. साइनोसिस है और पल्मोनरी ब्लड फ्लो डिक्रीज रहे. So this has to be studied. So first we will go for in cyanotic heart disease where decreased pulmonary flow. Cyanosis आ रहा है but pulmonary flow decrease है. That means blood is not entering much into the pulmonary trunk or into the lungs. Lungs में blood का फ्लो ज़्यादा नहीं है. ये साइनोटिक के हमने देखा है VSD में, लंग्स में जो है बहुत ज़्यादा ब्लड चला जाता है. ओके, so now cyanosis with decreased pulmonary blood flow, so where it can occur. So how to differentiate? एक बच्चा आपके पास आ गया, एक शायद केस भी हमने देखा था. Okay, so there is a cardiac problem, is everything is there, and child is not having the history of recurrent respiratory tract infection. This is one of the important clue. Okay, when there is no history of recurrent respiratory tract infection in cardiac problem, that suggests that probably underlying problem is associated with the decreased pulmonary flow. We know that increased blood pulmonary flow itself is one of the cause for the repeated respiratory tract infection because of the congestion and all those things, hyperdynamic circulation. But जब वो lower respiratory tract infection का history नहीं देता है, so probably you have to now imagine that this is a condition where there is a decreased pulmonary flow. अगर इंक्रीज होता तो डेफिनेटली रेस्पिरेटरी ट्रैक्ट इन्फेक्शन का हिस्ट्री देता. ओके, देयर इज नो पल्मोनरी एडिमा आल्सो, यस, बट स्टिल ही गेट द साइनोसिस. ओके, सो स्टिल ही गेट द साइनोसिस. अब साइनोसिस होने के लिए पल्मोनरी ब्लड फ्लो डिक्रीज, इसके बाद भी जो है उसको साइनोसिस हो रहा है. व्हाट आर द टू कॉज? टू इंपॉर्टेंट कॉज. वन इज ऑब्स्ट्रक्शन टू द राइट वेंट्रिकुलर फ्लो. व्हाट इज दैट? Blood is coming into the right ventricle. From the right ventricle, now it has to go to the pulmonary trunk. From the pulmonary trunk, it has to enter into the lungs. Now the problem is there is some obstruction in the pulmonary trunk. और डिस्टल में हो सकता है, प्रॉक्सिमल में हो सकता है, पल्मोनरी ट्रंक का बीच में हो सकता है, बट देर इज सम ऑब्स्ट्रक्शन. सो व्हेन देर इज ऑब्स्ट्रक्शन इन द पल्मोनरी ट्रंक, व्हाट एक्चुअली हैपेंस? राइट वेंट्रिकल में जो इम्प्योर ब्लड आ चुका है वो क्या हो रहा है? वो आपका लंग्स को रीच नहीं हो रहा है. Okay, now when it is not reaching the lungs means it is not get purified. When it does not get purified means oxygen saturation is very less, and that leads to cyanosis. Okay, suppose there is a total pulmonary stenosis, है ना, pulmonary जो है seminal valve that is undergone stenosis, or there is infundibular constriction. Okay, so like this condition where there's a total obstruction or partial obstruction, sometime may lead to cyanosis. This is one of the obstructive cause for the cyanotic heart disorders. Another is non-obstructive cause. What is that non-obstructive cause? This may happen in right to left shunt. We have seen left to right shunt in case of a cyanotic heart disorder, VSD. So जब VSD बहुत ज़्यादा हो जाता है, okay, so even the right ventricle also undergo hypertrophy, and a point comes where the right ventricular muscle mass is more than that of the left ventricular muscle mass. Now the flow of the blood is from the right side to left side. When the flow starts from right to left side, in the right side impure blood is there, left side pure blood is there. So now what happens? Impure blood mixes with the pure blood and oxygen concentration falls, and there is a cyanosis. So this is a second important cause. This is a second important cause for cyanotic heart disease. One is obstructive cause, another one is a non-obstructive cause. In the non-obstructive cause, it is a right to left shunt. It is also called as a reversal of a shunt. It is also called as reversal of shunt. I hope you understood. Now we come to the next part. अब हमने क्या देखा? Cyanosis developing with a decreased pulmonary flow. We have two causes. One is either obstructive cause, इसकी वजह से pulmonary flow decrease रहे, या तो reversal of shunt है, right to left है. So right से सीधा blood left में जा रहा है और pulmonary trunk में जा ही नहीं रहे. ठीक है? So these are the decreased pulmonary flow. Next come to decreased pulmonary flow. Now when there is a decreased pulmonary flow leading to cyanosis, again it is divided into two types. Okay, cyanosis है, decreased pulmonary flow है. क्या है कि decreased pulmonary flow है, congenital cardiac problem with a decreased pulmonary flow, cyanosis is there, but this cyanosis is coming early and cyanosis is coming late. That means decreased pulmonary flow is the cause, cyanosis is there, cyanosis is present immediately after birth, coming early. Another is cyanosis is coming later. इसका cause भी अलग अलग है. So what is that? Again we will see. Cyanosis coming late. पहले हम देखेंगे cyanosis बहुत देर में आता है. देर में मतलब महीनों बाद या सालों बाद आता है. Okay. Decreased pulmonary flow with the cyanosis appears late. What are the cause? The one of the cause is there may be constriction of the infundibulum. Infundibular area आपको पता होगा. If you know the heart anatomy, infundibular area. ठीक है? So जहाँ पे ये pulmonary trunk सब जाता है, infundibulum, which is under the sympathetic nerve control. Infundibulum जो है, so that is actually under the control of sympathetic nerve control. Now what happens is, as we know, when there is a fear, when there is cry, when there is exercise, there will be increased activity of the sympathetic nerve system, isn't it? जैसा sympathetic nerve system, fear है, cry है, exercise है, जो भी है, तो वहाँ पे सब sympathetic activity बढ़ जाता है. Sympathetic activity बढ़ते ही जो है आपका blood flow actually बढ़ जाता है. ठीक है, बढ़ जाता है. But बच्चों में जो infundibular area है, ठीक है, infundibular area है जहाँ से राइट pulmonary trunk, aorta ये सब ओपन होता है ना, तो वो infundibular area है. So that will be under the control of sympathetic nerve system. But बच्चों में क्या होता है कि in children the sympathetic nerve system is not well developed. Therefore, during the fear also, during the exercise also, during the cry also, expected amount of sympathetic drive will not come, and expected amount of the blood ejection will not take place. So again, there is a decreased pulmonary flow with the cyanosis in case of infundibular constrictions. So it takes a long time. If such is the case, it takes a long time to evolve and cyanosis appears late. अंदर प्रॉब्लम है, पल्मोनरी फ्लो नहीं जा रहा है, ठीक है, इन्फेंडिबुलम का कंस्ट्रिक्शन है. बट बच्चों में जो इन्फेंडिबुलम को सपोर्ट करने, कंट्रोल करने वाला जो सिंपैथेटिक ड्राइव है वो बहुत वीक रहता है, डेवलप नहीं होता है. इसलिए अंडरलाइंग प्रॉब्लम होने के बाद भी जो है साइनोसिस विल नॉट डेवलप इमीडिएटली आफ्टर बर्थ. इट टेक्स ए लॉन्ग टाइम. सो दिस इज वन ऑफ द कंडीशन वेयर decreased blood flow with the cyanosis, but cyanosis coming late. Now look into the other part. Decreased blood flow, cyanosis is there, and cyanosis start early, immediately after birth, maybe. Okay, so when this occurs, cyanosis एक दो दिन के अंदर आ रहा है, एक हफ्ते के अंदर आ रहा है, when it can occur? Yes, this can occur in case of admixture pathology. What do you mean by admixture pathology? Pure blood और impure blood जहाँ पे mix होता है उसको that is usually called as admixture pathology, like in shunting in case of VSD और PDA etc. Okay, मतलब प्योर ब्लड एक चेंबर में नहीं जा रहा है, इम्प्योर ब्लड एक चेंबर में सिस्टमेटिकली नहीं जा रहा है, ये दोनों कहीं ना कहीं मिक्स हो रहा है शंटिंग की वजह से. सो दैट इज कॉल्ड एज एडमिक्सचर पैथोलॉजीज. ओके, सो इन केस ऑफ एडमिक्सचर पैथोलॉजीज द साइनोसिस कैन डेवलप अर्लियर. Okay, because deoxygenated blood enters into the oxygenated blood directly, as in case of VSD. This is possible admixture pathology like pulmonary anomalous venous. So this is one cause. Suppose there is a VSD, what is happening? The pure and impure blood is mixing. अगर वो रिवर्सल ऑफ शंट हो गया तो impure blood mixes with the pure blood. अगर नॉन रिवर्सल ऑफ शंट है तो प्योर ब्लड मिक्सेस विद impure blood. मतलब जैसा VSD में हमने पहले भी बताया था मैंने, VSD में एक बार जो है ब्लड पूरा आपका पल्मोनरी ट्रंक के थ्रू ऊपर जा रहा है, लंग्स में जाके प्यूरिफाई होके लेफ्ट एट्रियम में आके लेफ्ट वेंट्रिकल में आ गया. लेफ्ट वेंट्रिकल में आने के बाद जो है वो आपका राइट वेंट्रिकल में जो इम्प्योर ब्लड है उसके साथ मिला रहा है. मतलब ब्लड तो प्यूरिफाई हो गया था, उसके बाद वो मिल रहा है. तो इसलिए जो है ऑक्सीजन कॉन्सेंट्रेशन इतना नीचे नहीं गिरता है, इसलिए वहाँ पे साइनोसिस आता भी नहीं है. बट अगर रिवर्सल ऑफ शंट में, जैसे यहाँ पे बताया, रिवर्सल ऑफ शंट होगा राइट टू लेफ्ट शंटर, इम्प्योर ब्लड है ना ऊपर जा ही नहीं रहा है, राइट वेंट्रिकल में आते वो सीधा लेफ्ट वेंट्रिकल में जा रहा है ना, प्योर हो ही नहीं रहा है. तो क्या है कि परसेंटेज ऑलमोस्ट ऑल जीरो है. Percentage of oxygen in the blood is almost all zero. So there will be development of cyanosis at the earliest. Okay, so now this is one condition. Second is sometime cyanosis, decreased blood supply to the lungs, cyanosis is there coming early. Another important cause is pulmonary veins directly opens into right ventricular atrium. See, pulmonary veins, they bring the pure blood from the lung. They have to open into left atrium. From the left atrium, blood comes to left ventricle. But यहाँ पे क्या होता है? So instead of they opening into the left atrium, they directly open into the right atrium or right ventricle. तो क्या हुआ? प्योर होके कोई फायदा ही नहीं है. प्योर होके आ गया पल्मोनरी वेन में और वापस जो है राइट वेंट्रिकल में चला गया, वहाँ पे वैसे ही इम्प्योर ब्लड है और वहाँ से वो वापस लंग्स में जाएगा और वहीं पे घूमता रहेगा ब्लड. Blood is not at all going to the left ventricle so that it can be get circulated all over the body. Therefore, there is lack of oxygenation to the tissues and child develop cyanosis immediately. Okay, now there will be hyperdynamic circulation and leads to CCF with the cyanosis which is develops early. Another condition where cyanosis develops is transposition of the great vessels. Pulmonary trunk रहना चाहिए राइट वेंट्रिकल में, आयोटा रहना चाहिए लेफ्ट वेंट्रिकल में. अब उल्टा हो गया, आयोटा है आपका राइट वेंट्रिकल में और पल्मोनरी ट्रंक है आपका लेफ्ट वेंट्रिकल में. अब क्या सोचा, आयोटा से ब्लड कहाँ पे जाएगा? ऑल ओवर द बॉडी में जाएगा. सो राइट वेंट्रिकल में जो ब्लड आ रहा है, जो इम्प्योर ब्लड है, वो अभी ऑल ओवर द बॉडी सर्कुलेट होगा. लेफ्ट वेंट्रिकल में जो आ रहा है, जो प्योर ब्लड है, वो पल्मोनरी ट्रंक के थ्रू लंग्स में जाएगा. ठीक है. सो व्हाट हैपेंस? देयर इज नो ऑक्सीजनेशन टेकिंग प्लेस एट ऑल. इम्प्योर ब्लड पूरा बॉडी में घूम रहा है और प्योर ब्लड वापस जो है आपका लंग्स में जा रहा है. अगेन दैट लीड्स टू साइनोसिस. साइनोसिस कम्स वेरी लेट, साइनोसिस कम्स वेरी अर्ली विद इन, क्योंकि ये तो पूरा गड़बड़ है ना. एक दो दिन के अंदर साइनोसिस डेवलप हो जाएगा, मे बी इन मिनट्स ऑल्सो. सो दिस इज अनदर इंपॉर्टेंट कॉज वेयर अर्ली साइनोसिस occur. Okay, so now what are the physical signs? Physical signs, actually we have to look into the apex beat. Precordium of the chest, that is very important. We have to look into the apex beat. So heaving apex, it's called as heaving. मतलब वहाँ पे बहुत ज़्यादा फंक्शन चल रहा है. heaving effect is sustained with increased amplitude and duration. जो apex beat का जो duration है वो ज़्यादा है, amplitude height वो भी ज़्यादा है. ठीक है. So why this is happening? Because हाइपरडायनामिक सर्कुलेशन वहाँ पे चल रहा है. मतलब पल्मोनरी फ्लो कम है बट बाकी जगह में तो ज़्यादा ब्लड जा रहा है. ओके, सो टाइप ऑफ एपेक्स, टैपिंग एपेक्स, एपेक्स में जो आप देखेंगे तो हीविंग एपेक्स देख लिया. दूसरा टाइप का एक एपेक्स है दैट इज कॉल्ड एज अ टैपिंग इफेक्ट. टैपिंग इफेक्ट मीन्स इट्स सस्टेन एंड नॉट फोर्सफुल, टच एंड गो टाइप का है. ठीक है, ये तो रिपीटेड मैंने एक्सपीरियंस से पता चलेगा. ओके, एंड नॉर्मल एपेक्स बीट कैसे रहता है? टैपिंग एंड इल सस्टेन. ओके, दिस आर द फिजिकल फाइंड. दैट मीन्स वन थिंग इज वेरी इंपॉर्टेंट, यू हैव टू लुक इनटू द एपेक्स बीट एरिया. प्रिकॉर्डियल एरिया में देखना है, प्रिकॉर्डियल एरिया में क्या एक्टिविटी नॉर्मल चल रहा है और बहुत ज़्यादा धड़कने चल रहा है, या बहुत देर तक जो है एम्पलीट्यूड उसका ज़्यादा है, तेज चल रहा है. ठीक है, जो नॉर्मल एपेक्स बीट में क्या है, आप हाथ रखेंगे तब जाके आपको पता चलेगा. और बहुत थिन बेबी है तो यू कैन सी द एपेक्स बीट, अदरवाइज इट इज नॉट सीन. बट इफ इट इज इजिली सीन, इट इज वेरी प्रिडोमिनेंट. ओके, इट इज ओवर टैपिंग. ओके, इसका एम्पलीट्यूड ज़्यादा है, आपको लगता है कि कुछ ज़्यादा डायनामिक, हाइपर डायनामिक सर्कुलेशन हो रहा है, सो देन इट इज एबनॉर्मल. सो दैट इज वन ऑफ द इंपॉर्टेंट फिजिकल फाइंडिंग. So this is about the cyanotic heart disease. The simplest way of understanding cyanotic heart disease. Okay, cyanotic heart disease. First of all, you have to differentiate between the peripheral cyanosis, central cyanosis. Okay, I think how to understand the central cyanosis. Central cyanosis, peripheral parts of the body में नहीं आता है. Central part of the body में आता है. It may be in the lips, it may be in the tongue, it may be in the other mucosal part. Okay, so peripheral cyanosis always occurs in the peripheral parts of the body, and peripheral cyanosis gives good response for the oxygenation, and central cyanosis will not give any response to the oxygenation. Okay, it's because of the shunting pathology. Now, cyanotic heart disease has to be differentiated from the breath holding spells. Okay, and it has to be also differentiated from the cyanosis of the respiratory disorders. That also we have seen. Then comes the cyanotic heart disorders. Cyanotic heart disorders are basically with the increased pulmonary flow and decreased pulmonary flow. And we have seen what are the conditions for the increased pulmonary flow, and we have also seen the conditions for decreased pulmonary flow. If it is decreased pulmonary flow, again it is with the cyanosis coming late and cyanosis coming early. Okay, so this point we have already covered. And so with this we conclude the cyanotic heart disorders in short. Now in the next class we will see some of the important cases so that we will have a clear-cut understanding. Thank you.